Hello, everyone. Welcome to Hanul's home care info session and private pay launch. We are excited to have you. If you are just tuning in live right now, feel free to comment that you're here, say hi, support the Hanul family over here. So today we're going to be talking about home care info session. We're going to explain the private pay launch, the initiative, sort of the agenda. I'm going to start off by giving you a little bit of a background on who I am, why I'm here with Hanul, and how that all transpired. And then we will pass it on to Irene, who will talk about hi Bree. So Irene will talk about a little bit about the history of Hanul, and then followed by Nare. Ray's going to talk about home care, and this might be a benefit to you guys. So pay attention because you're going to get some really amazing information. Share if you know a lot of people in the Korean community, because we're going to give a lot of juicy stuff. So stay tuned till the end as well to hear all about it. And then in the end, we're going to have Kate introduce herself. She is in charge of the home care private pay for Hanul. So she is going to go over the process and everything. And then we'll have some time for Q&A. And then I will close it off again. So welcome again. My name is Laura Robertson. I am Sales and Marketing Director that is working with Hanul as well as Chinese Mutual Aid Association, funded by the Retirement Foundation. It is an initiative to help two nonprofit organizations launch into a private pay sector jointly by using me. I was hired as a sales and marketing manager to kind of oversee both organizations to kick off the private pay sector. And the reason why this is super important is that both organizations, them being nonprofit or solely relying on government funding and grants to help the organizations. And so with the private pay initiative, we are able to serve more of the community that need us. And so being able to provide the language, being able to provide that companionship, it just all makes sense. And we're only servicing with what's going on right now with home care, which Nare will explain a little bit later. We have a lot of clients that are not being serviced, and we're super, super excited to announce this joint partnership that we are sharing resources together, CMAA and Hanul. We are super excited for that mission. And thanks once again, huge thanks to Retirement Foundation. Without them, this would not have happened. And we just truly, truly want to thank you. We're able to serve more of the Korean adult population who can afford or pay, who can go into the sector of private pay. And so I do want to introduce a little bit about CCP, what that is, and when I say private pay, what private pay actually means. So CCP is community care that is funded by the government. And so there are strict guidelines for that. And this program helps the elderly, the adults population, the older adults stay at home in the comfort of their own home, and they fund the home care aides to come and take care. You have to have strict guidelines. You can go to the CCP website and you'll be able to see all those guidelines. Or you may reach out to one of these lovely ladies and they will tell you exactly how to reach out to them. So you can see if you qualify, if you have an elderly loved one that is at home that needs care, there are government funding. If you qualify, you'll be able to get someone, our amazing home care aides, to be at your home to take care of your family, your parents. And so the difference with private pay is just the opposite. Everything is still the same. The care, everything is still the same. However, just the way that it's paid. Through private pay, the clients are actually paying out of their own resources. And some of them might have long-term care insurance. Some of them might qualify for veterans benefits. Some of them, might have their own funding that they want to use towards this. And so that's just the difference. The care is still the same. It's just the way that it's being paid, either through the government grant or self-pay. And so the benefits of Hanul Home Care is going to be discussed by Irene. She is going to come on next. Irene is the executive director, who is amazing. So be sure to tune in. She's going to give you a nice history of Hanul, what it stands for, what they do, and some of these resources. If it's not for you, it could potentially be for someone that you know. So be sure to take notes if you need to, and pay attention, because we've got some really, really great, amazing things that if it's not beneficial to you, it will be beneficial to someone you know in the Korean community. So thank you so much. And with that, I will pass it on to Irene.
Hello, everyone. My name is Irene Son, Executive Director of Hanul Family Alliance. Laura, thank you so much for the wonderful introduction. And it's been just such a pleasure to work with Laura. And again, another huge thanks to our funder, RF Foundation for Aging, to support this whole initiative of private pay. And it's been also a wonderful experience working with our wonderful partner organization, CMAA, to go through this journey together. So today I am actually going to talk a little bit about the organization and how we got to start and what we do today. And then I'll be asking our wonderful home care manager, Nare, and our wonderful home care coordinator, Kate, to take over to explain more about the home care side. So Hanoi Family Alliance is actually almost 35 years old. Social service organization that was founded in 1987 by a group of
Sorry about that, guys. I technical difficulty, but she should be bouncing back shortly. So, technology, right? So we're waiting for her. If you guys have any questions, please feel free to put it in the chat. We are actively reading the chat box. Feel free to share with your family members, any Korean groups that you know out there that may benefit this message, because you're going to get some really, really amazing information here. Stuff that you may not have known before, because Hanul is a social service agency that actually helps low-income immigrants and refugees. So with lots of different services that are available that you can take advantage of if you don't know about it. So I think she is coming back. So I'm going to add her back on. Pay attention, share, guys. So we've got Kate back here. Technology, right? It's cool. We got you back.
Sorry about that. It's a real experience of going live, right? So here I am. I hope I don't cut in again, but to continue with my part. So the organization has been around 35 years. We do provide wonderful services in all three office location areas that are in Chicago, Mount Prospect, and Buffalo Grove. And to explain a little more about our core service areas, so we have three service areas, which are healthy aging, family wellness, and community engagement. And healthy aging, of course, has been the longest running program for our organization since our inception. So home care being our oldest program, we're very, very proud to have a wonderful group of home care aides and our department staff, and they help out each year close to 400 seniors. And we currently have about 150 home care aides that are working for our organization. And besides our home care, we also do wonderful nutrition programs, which includes daily lunch pickup services, delivery services, and public benefit assistance is also provided to any individuals that are in need of government assistance, entitled programs such as SNAP applications, housing applications, Medicare, Medicaid, all the questions about these government programs are being answered by our wonderful bilingual staff members. And going over to our family wellness program, which is relatively new since we changed our organization's name to Hanul Family Alliance in 2007, we really started to expand our services to all members of the family. And by the way, Hanul actually means it's a Korean word that means one large family. So before we used to be called Korean American Senior Center, but we really wanted to open our doors to everyone in the community, regardless of their age, regardless of their ethnicity. So although in our vision and mission statement, it says, we want to help out Korean community and Korean seniors and families. No, it's not true that we only serve Korean community. We serve everybody. Everyone is welcome in the community. So going back to our family wellness program, we do counselings, we do support groups, and then we are also licensed service provider for substance abuse counseling. And then community health projects are going on. And right now we're doing a lot around COVID vaccinations. We're trying to get our seniors also vaccinated with their booster shots. And we also do hepatitis B education. So different programs are going on all the time. And then immigration service is also something that we're very proud of. As an organization that is also acknowledged by Department of Labor, we are a authorized immigration service provider to help people out with citizenship applications, and all kinds of immigration information and resources are provided here at our offices, at all three of our offices. So do seek out for these services. And lastly, community engagement is a program that's been mostly impacted by the COVID pandemic. Unfortunately, we're no longer able to gather in person, to learn, to share, to enjoy each other's company. However, we've been doing our ESL, computer, and other classes virtually, and also health and recreational classes. Some of our classes are meeting over Zoom, and our instructors is doing a wonderful job teaching our seniors to keep moving their bodies over the screen. So I'm very, very proud of our team members who have adjusted to this new pandemic world. So we continue to stay in touch with our seniors and families, people that are in need of. So without saying any more about core service areas, I actually want to show a quick video clip of our services and our programs and how we've been doing in the past year during the pandemic. So let's watch this short video clips together. So as you could see in the last page of the clip, this video was made for Giving Tuesday 2021, which ended with a huge success. I thank everyone who supported our organization during our Giving Tuesday 2021 campaign year. And then we are just totally excited to have such a wonderful group of staff members and home care aides that have never stopped providing the essential care for our loved ones that are most vulnerable ones and that are also are part of our family members. So I thank you. And before I ask the screen to over to Nare and Kate, I just want to quickly show how many clients that we served over the pandemic. For the past year, we served over 8,000, almost 9,000 clients during the past fiscal year. And of those, 84% were seniors 60 and older. 84%. And then as you see in the graphs at the bottom, our home care services grow each year in the past 3-4 years. And then it's very surprising to see how the services are more demanded even during the pandemic. So our home care service will continue to grow, and we're going to be needing everyone's support to grow this wonderful initiative and support. And we are also in need of many, many new workers to be part of our team. Okay. Um, Before we talk about the home care more specifically, I also just want to quickly touch base on our core values. So everyone at Hanul Family Alliance, we emphasize these 5 core values. Whether you're a staff, whether you're a volunteer, whether you're a client, we really emphasize that these are 5 core values that we all try to live by. First one, passion. Everyone at Hanul is passionate about providing help to each other and just taking care of each other. And then trust. We have to have the trust. We have to trust each other to have the relationship strong and solid, right? And then teamwork is also a very important value that we keep. Everybody is part of a team. No one is by themselves. We are always supporting each other. And then fairness. We try to keep everything fair, whether it's between staff to staff, client to staff members. Fairness is a very important value. And then lastly, acceptance. We accept everyone's different backgrounds. We accept different values and we respect that we're all different. And that's what makes Hanoi more beautiful. So, having said this, I also want to emphasize that our home care program, both private and Medicaid, the CCP side, we value these 5 core values very much. So know that when you're thinking about getting services from Hanoi, know that these 5 values will be very, very much respected and carried on during every step of our service. Without further ado, I want to introduce another short clip that's going to highlight one of our home care aide and a client story. And then I'm going to ask Nare to take over the stage. Thank you.
여기 장난이 이거는 신랑이고.
Black? I like black.
응.
Yeah. Thank you. 어떻게
잘하고 있어.
전화를
잘하고 있어.
제 이름은 김성석이고요. 하늘에서 6년째 일을 하고 있고요. 제 포지션은 홈케어 매니저로 일을 하고 있습니다. 이 일 시작할 때는 정말 어른들에 대해서도 모르고 제 자신만 알았었는데 하면서 보니까 정말 제가 죽여야 될 거, 그리고 어른들의 소중함, 이런 게 너무 컸었어요. 어른들이 편함을 느끼면은 그게 진짜 마음에 너무 편안하고, 갈 때는 오늘 만나서 행복했습니다, 그렇게 인사를 할 수 있는 그 정도는 된 것 같아요. 이제 앞으로도 계속 제가 힘이 닿는 데까지 계속 어르신들하고 함께 생활을 할 거고요. 그리고 제가 이 머리가 짧은 거는 다 이유가 있죠. 작년에 유방암 판정을 받고 수술을 했습니다. 근데 우리 진짜 하늘에서 너무 많은 도움을 주셔가지고 제가 잘 케어를 하고 지금 2월 달부터 풀타임으로 다시 일을 하게 됐는데 그동안에 정말 어르신들 너무너무 보고 싶었어요. 아이폰이 아닌가 보구나. 그래서 모르는 거야.
이건 셋째 손.
그래서 가끔 항암 치료를 받을 때마다 방문도 하고 그랬는데 모든 분들이 앉아서 저를 기도로서 진짜 후원해 주시고 그래서 지금 이 자리에 왔습니다. 저는 제가 암을 가졌다는 생각을 해본 적은 없어요. 항상 즐겁게.
이 김성숙 씨하고
네네.
함께하는 이 벌써 사이 한 가족처럼의 또 친구처럼 이렇게 아주 마음이 편안합니다. 편안하고 아주 즐겁죠.
너무 고맙습니다. 사랑합니다, 여러분. Thank you, everyone. Support us.
Thank you. So now I'm going to have Nare speak about the home care program.
Sorry, Nari, would you unmute it, please?
Oh, sorry. Good afternoon, everyone. My name is Nare. I am a home care program manager here at Hanul. I first of all want to thank everyone who joined this info session to learn more about our services. And I hope you learn, a lot more that you can spread the words of these type of services and that more people are getting helps from hopefully Hanul. So for my experience at Hanul, I've been working with Hanul for over 3 years now, and I am very grateful that I am working with Hanul and helping our vulnerable communities, especially the seniors. And so let me go more in detail about our home care program. So so you might wonder, what is home care? So home care is a non-medical support. Is done by supervised home care aides who have received specialized training in the provision of in-home services. So basically, home care program service is that we help individuals, especially the vulnerable individual, to go through their daily lives by getting support from our home care aides. So our home care aides visits our home care clients and help with their daily chores, daily tasks. And it prevents these clients for going into perhaps a long-term supporting facilities such as nursing home or even hospitalization. And so you might wonder, okay, so then what do home care aides do? As you can see on the slide, on the screen, we do various things. So a company is number one. We go in and monitor the client's conditions, health conditions. Furthermore, we become just one of the best friend for the clients. So despite the rising COVID, home care is one of the services that most seniors or family member wants and needs, because our home care aides are the one who's checking on our clients regularly or even daily. So a company is big part of the service. The other part is transportation to medical appointments or even errands such as shopping. So grocery shopping or even a medication pickup is part of the transportation. Also assisting with self-administered medication, medication reminder is another big task of our home care aide. And non medical personal care tasks such as grooming or dressing. Some of our clients are even having hard time buttoning their dress themselves. So our home cares are there to help those individual in need. Then another important part of the task is meal preparation. um, is a lot of our seniors are alone in their apartment, and sometimes they just can't even go to the grocery shopping by themselves. So our home care aides are crucial, and they prep the meal for the day or even throughout the week. And our seniors are rely on our home care services heavily. So another part of the meal preparation is that Hanoi is known for having such a great uh, multiple backgrounds. So if clients need a Korean meal, we have home care aides who can perform wonderful and delicious meals for the individual. And routine light housekeeping, such as laundries, is part of the task. So, a lot of our seniors do have physical limitations. So, cleaning is very limited for our seniors. So, our home care aides does light housekeeping tasks throughout the service hours. So the next slide, we want to talk about who can receive home care service then. Is my parent perhaps is eligible for a home care program? So let me tell you. So for home care service, if an individual is over 60 or older, they're eligible. Or if individual is determined physically in need of services and support based on the comprehensive assessment tool, then they are also eligible to receive home care service. Here, a comprehensive assessment tool is something that the client's coordinator that are assigned by the state will conduct. And usually it takes about 2 to 3 hours. And so you might think, oh my goodness, it takes forever. But this is a opportunity for the coordinators to find out what really needs for our seniors. And so this is done annually. Some cases it is done every 3 months. Another eligibility is that you must be a resident of the United States as a citizen or a qualified a non-citizen within specific categories, or you have to be also a state of Illinois resident. And the other big part of the eligibility is you must meet the assessment requirements. To give you more solid number, for one individual, the asset has to be less than 17,500 a year. If it's for a couple, then the asset limitation has to be less than 35,000 a year. And once the client agrees to apply, and if they're found eligible, then the coordinator can also assist clients with the Medicaid applications and benefits. And the next slide, I want to talk more about the working with Hanul. we are looking to hire more home care aid. As I mentioned, the needs and wants of home care service is increasing every year, and we are looking to hire more home care aides to assist our community. So if you are a hardworking, dependable, a passionate, motivated individual who is looking to make a lasting impact on the lives of others, please do reach out to us. We would love to assist you. Um, you know, get you more information about working as a home care aide, or if you know of somebody that's looking for a job, please do reach out to us. And at the end, we have a Q&A session. So if you want to more about a home care service itself, you are welcome to ask any questions at the end. So right now, I'm going to toss the stage to our private service coordinator, Kate.
Hello. Hi. Hi. My name is Kate Jung and private home care coordinator of Hanul. So nice to meet you. And it's my honor to present private home care today. So Hanul private home care, Hanul Home Care expanded its service to private pay since 2017. And then 2017, Hanul Family Alliance received its private home care license issued by Illinois Department of Public Health. It means now Hanul can offer the home care services no matter their age or the income range or where their home may be in Chicago area. And I'm going to talk about eligibility. So based on the experience and legacy of Hanul Home Care for past 30 years, Hanul Private Home Care provide customized and professional service to anyone who needs personal care to improve their quality of life and remain independent in their homes. And I'm going to talk about our home care aid a little more. Yeah, so 100% of our home care aides are background checked and registered in IDPH. So Hanul home care aides are trained care professionals who support our client with all the activities of daily living, include, I know already Nare mentioned that, including meal preparation, cleaning, laundry, grocery shopping, running errand, and uh, maybe accompanying the client to their doctor's office, so on and so forth. And we can start this private pay process with initial assessment meeting. What that assessment meeting, we can come up with the care plan. So we tailor each client's care plan to their lifestyle and need. And with this care plan, we carefully match with our caregivers. And then finally, we draw up the service agreement between Hanul and client. I'm going to talk about my experience from an elderly woman in her 80s who needed home care services while fighting cancer, to a widower in his late 70s and who only needed like help with meal preparations or companionship after suddenly he lost his wife. We're doing our best to provide service they need. Moreover, we offer really competitive and affordable service fee. So I hope you don't have misconception about private home care, Hanul private home care, which is private home care is really unreasonably expensive, or it is only for the elderly with infirmity. It's not true. I believe this is more about. Um, I believe it is more about empowering elderly others' independence and improving their quality life. So please do not hesitate to contact us. Um, if you have loved ones who need help and personal care, please contact to us. And I know this is holiday season. That's why I wear like Christmas color outfit today. Yeah. So this is season of yeah. This is season of sharing love and gifts with your loved one, and I believe the uh, the Hanu private home care service is the best way to one of the best way to share your love with your elderly family member who lives a remote and lonely life. And Yeah, and I hope that you let more people around you know about a private Hanu private home care, so that more people can get help and benefit from it. That's all I want to say today. Thank you for listening, and I'll invite you not narrate like Laura, so that we can have like Q&A session, please. You need to unmute it, Laura.
Here I go again. Okay. Hi guys. Hello, I'm back. So we're gonna have a Q&A, and I already saw a few questions that came in here. Thank you, Kate, for explaining that. And I must add, it's also important for you if you are someone who is caring for an elderly parent, because as we're aging, our parents are getting older, and I had to experience that myself, having to care for my mother. So even if it's, getting 10, 12 hours a week, like just to relieve you guys off of, just to have your some me time, because I once was there, was burned out, but we love it. We do it because we love it, caring for an elderly parent. And so just, reach out to us just to have that discussion. Kate will walk you through and give you a customized plan. Your care is based off of your needs. So there's no one set price. There's a range just based on your needs. And so even if it's just 12 hours a week, 10 hours a week, something that will relieve you of, having to care for your loved ones, because you can't pour from an empty cup. You just simply cannot pour from an empty cup. And so if you are pouring your heart out, having to work, then having to come home, having to coordinate your elderly adult parents or family members, you need that break so that you can continue to have that strength to continue to help them. And we're just a phone call away. And so we're going to now take some Q&As. This is Kate's information. If you guys want to reach out to her, she's an amazing, lovely person, and she will make sure that your questions are answered. And so we did have a couple of questions pop up from the audience. We have someone ask if they can apply for private help for house chores. And the answer is yes. For light housekeeping, you can get a private care or home care for that as well. And the other question, next question, feel free, you guys can jump in as well. The next question is, how much do you charge? And Yuni, the best way to answer that is to contact Kate, because the price range does range based on your needs and how many hours that you get. So it's best to kind of have that consultation where Kate can walk you through, and you might be surprised. Maybe you'll qualify for some of the free help that's out there for you, and so that you're not kind of struggling alone. And then the other question, and you guys could maybe answer this. I don't know what the rules are. Can you send home care service for disabled person that are not seniors? Is that yes?
Yes, of course.
Okay, awesome.
Yeah.
Yeah, okay.
Yeah.
The answer is yes, Yunyi. If you're still there, the answer is yes, or if you're tuning in later. And then anyone else have questions, please put it in the chat. We'd love to answer any of your questions. Otherwise, you can always contact Kate, for a phone consultation, by email. Kate, if you could put that back up again so people could see. So she is the private home care program coordinator. And as you can see her phone number there, you can reach her directly or the home care line, or you could also email her as well. We also have our website. You can go and feel free to visit our website. We have a separate home care website than our Hanul Family Alliance website. So the private pay and the home care website is hanulhomecare.org. So if you have any questions on what we do and all of that, feel free to jump on our website. Oh, Yuni, you're welcome. You're so welcome. I hope we can help you out. Thank you so much for tuning in.
And Laura, if I may add a little bit, for the Korean-speaking population who might be joining today,
please do.
네,
I'm
오늘은
soon.
네네. 오늘 저희 세션은 첫 번째 진행되는 버추얼 이벤트 행사로 저희들이 영어로 모든 정보를 준비를 했지만 저희 기관에서 일하시는 모든 분들이 다 영어와 한글을 아주 사용을 편하게 하실 수 있는 바이링구얼 스태프분들이 계십니다. 그래서 영어를 사용하시는 자녀분이라든지 또는 한국말이 편하신 어르신들이라든지 얼마든지 저희 우리 정경화 선생님, 케이트 정, 그리고 김나래 선생님에게 연락을 주시면은 언제든지 저희들이 영어이든 한국말이든 친절하게 여러분들의 질문에 답해 드릴 수 있습니다. Thank you.
Oh, awesome. Thank you, Irene. I absolutely understood everything you said, but I'm going to learn it soon. Being around you guys, such amazing group. You guys, if you are watching this on a replay, also please feel free to share. And if there are no other questions, then we are going to kind of close it up. So private care, home care, it's all the same. We are just wanting to open up to serve more of the population that we have not been able to serve over these years since we received our private pay license. And so once again, I just want to thank Retirement Foundation for their generosity. Such an amazing organization that has given to Chinese Mutual Aid Association and Hanul to launch this private pay initiative. And we are just amazingly thankful that we are going to be able to serve a bigger population of Korean adults, older adults, and also, CMAA clients as well as we go into the new year. So if anyone does not have any more questions, I will, let everyone, if you want to give your closing remarks. Otherwise, everyone have an amazing and safe holidays. Please stay safe out there. We're not in the clear yet. Please stay safe. I know that it's family time. Protect yourself and go. Let's go into the New Year's with a nice bang and have an amazing 2022. So
wish you a happy holiday.
Happy holiday.
Awesome. Guys, for tuning in.